I am really excited to be here with all of you today virtually to just talk about how precepting can bring us joy and improve our wellness. I'm originally from Ohio, so it's kind of nice to work with the Ohio Academy on this and use my Ohio connection. But I know some of the people on the line aren't from Ohio either, so I can use my outside of Ohio connection to bring us all together. So I'm really excited. So I wanted to first start with just two stories about medical students. So the first medical student just finished her first year, and she is doing a preceptorship over the summer, and she did it through the Ohio Academy of Family Physicians. And she was assigned to a family physician who has a solo practice. She didn't know much about family medicine, but soon would learn a lot. She was able to be with that preceptor throughout her workday and see all of the amazing relationships that the family physician has with her patients, not just one member of the family, but the entire family. And you could tell that those relationships had happened for a very long time. And there was a great bond between the patient and the physician. There was shared decision-making, and they really were a healthcare team together, trying to take care of patients the best way that patients could take care of themselves, and the preceptor could take care of the patients as well. And as the student was able to learn the process and learn a little bit more, she was able to participate in that as well. She really, at the end, was able to see that family physicians are a one-stop shop for families and can really take care of all of their needs. With this preceptor being in solo practice, she obviously saw the administrative side of being in a practice and as a family physician too. I think but the one thing that was admirable from the preceptor side was that she showed how it was advocating for the patient and making sure that the patient got the tests that they needed or the medications that they needed. So that student left her summer preceptorship with her eyes opened and really thought that family medicine could be a specialty for her. So that's student number one. Student number two is a third-year medical student who is doing her family medicine clerkship at a residency program. And the preceptor really wanted to show this student the full breadth of family medicine: inpatient care, maternity care, procedures, just all the things that we can do with family medicine. So that student could see all that we have to offer patients. So the preceptor actually does C-sections. And so she took the medical student into the operating room with her where the student could first assist. And the student had done her surgery rotation, her OB rotation, but she hadn't ever done anything like that before. And so right when we were about to deliver the baby by cutting the uterus, the preceptor had the student just feel which way the uterus was and how the baby was. And that was this amazing moment for the student. She had never gotten to do anything like that. Then she was able to help suture. After the baby was delivered, she got to hand the baby over to the pediatricians right after the baby was delivered. And 2 weeks after the family medicine clerkship experience, that student told the preceptor that she wanted to be just like her. And so that was a really rewarding experience for both the student and the preceptor. And so that is student number two. So student number one was me as a medical student, and I got to precept with Dr. Sarah Sams in Ohio, if any of you know her, and she's amazing. And student number two is a student that I had the opportunity to be the preceptor for and really pay it forward from everything that I learned from Sarah Sams. And just that important piece of the relationship. And so I just wanted to kind of share those stories, like one, how it impacted me, but then how I had the opportunity to impact somebody else. So I think just as we go through this discussion, and we really do want this to be interactive, in just a little bit here, just trying to, one, channel our inner experiences of what we had as a medical student and how those important experiences impacted us. But then also relationships that we may have had with medical students as preceptors when we're thinking about our wellness and what that brings. So there's definitely benefits and sometimes some challenges to having a medical student in your office and being a preceptor. In terms of the benefits, I think I actually posted some of these questions on Facebook just to kind of get a collection of responses, like from other family physicians who are across the country. And a number of people said that it really brings them energy and passion, and it keeps them excited about why they want to be a family physician. Because when you see medical students getting so excited about things that you see every day, it's just inspiring to remember that everything that we get to do for patients in our offices is a really special opportunity. Another piece is that sometimes medical students can connect it with patients in ways that we can't. So if they share a particular hobby, or if the patient has a primary language that is not English and the medical student is fluent in that language, there's a lot of different ways that medical students can help. The third way is that medical students can keep us on our toes. I think we all can think of a time that a medical student asked us a question and we didn't quite remember the answer right off the top of our head. So, having that opportunity to show that one of the biggest things as a family physician is to know where to look things up, so you can look things up with a medical student and everybody learns together. And then the last benefit is being able to pay it forward. That we have already talked about a little bit here. So those are just kind of, I think, some of the benefits in terms of wellness that it can bring to our practice. And then there's actually some very tangible benefits of being a preceptor as well. First, the AFP gives CME credit for teaching, and so that is a huge bonus. Next month, the Society of Teachers of Family Medicine, or STFM, has been working with the American Board of Family Medicine, or ABFM, to be able to get performance improvement credit for precepting a medical student. So that is pretty exciting. Some states across the country offer tax incentives for preceptors, for recognition as a preceptor as well. So a lot of different chapters across the country, have Teacher of the Year awards, and sometimes that's a full-time teacher, but that can there's a lot of places that have community preceptors as well. And then STFM actually is working on a specific kind of recognition for preceptors as well, to show how much not only the students appreciate the work that everybody is doing, but that the organizations of family medicine do as well. Now, there's some challenges, and a lot of it revolves around time. I think a lot of our wellness revolves around time as well. So for students, it requires time to teach. And so, wanting to be able to, maybe prepare something to teach the student about on a particular topic, that takes a little bit of time. And then it's time to see patients. So, giving the student opportunities to talk to the patient, and then you go in to see the patient, it can slow the flow down a little bit. And then it's time in terms of like, how can we be the best preceptors that we can be, and constantly trying to develop ourselves that way as well. So those are some challenges, but I would actually challenge us to look at it a little bit differently, and that there's lots of ways that we can use medical students in our offices every day to help with our patient flow, our patient care, and those kinds of things. So STFM actually has a specific strategy on how to use medical students in your office, and how students can add value to our offices, which I can definitely go through. But I thought at this point, we could stop and maybe kind of open things up a little bit, and have people either share a story of when they were a preceptor and kind of the impact that made on your wellness, or if there's a creative way that you have been able to use students in your office to actually help your time, instead of have this feeling of taking away your time. So if people want to just maybe introduce yourselves, say where you're from, and kind of, just where you work, before you make your comment, then we can all get to know each other. And then for those who haven't used Zoom before, in the upper right-hand corner, there's the speaker view and the gallery view. I kind of like the gallery view because it's kind of it's a bunch of tiles, and then you don't see a big square of my face if I'm talking, and we can just see each other equally. So who would like to go first and share either a story or a tip on medical student precepting?
Dr. Morris, I'm going to call you out. Start us off. I think.
Unmute. There we go. Yeah. So I take a couple medical students. I'm here in Columbus, Ohio. Here we have two medical schools now, both Ohio State University as well as Ohio University's College of Osteopathic Medicine. They have a branch campus here in Dublin. And so I take second years from both. Second years are kind of a fun, malleable time of year where they like getting their hands wet. They're getting tired of their nose being in books all the time. So it's kind of fun to get their hands wet a little bit, get them to actually listen to some murmurs. But at the same time, they're really helpful when it comes to doing like mini mental status exams, as well as having them set up a patient with an EKG every once in a while, or actually running the like strep tests or the flu tests, especially this time of year. And so it gives them kind of a little bit of connection. They all seem to really enjoy actually doing something instead of just being hunched over all day on a book, which has all been given like pretty good feedback for me. But that's what I liked as a student. So getting my hands wet and doing something fun. And so they seem to like it so far. But yeah, I'll let other people talk to it.
That's great. Thank you. How about other experiences that people have?
Would anyone else like to share? Dr. Bellister, I know you've taken a couple students.
Yeah, I agree. I'm sorry, I'm using a cell phone because I'm having some issues with my desktops. So I agree that it really is a mutually beneficial relationship. Teaching and then sometimes, I really don't know the answer to that question. So it forces me to do the search and to give a good answer. So I try to take as many students as I can. Unfortunately, I'm in Warren, which is like an hour away from Neomed, hour and a half away from Case Western. So those are the only two medical schools that have sent students to me. And then sometimes it's very hectic. Like a couple of weeks ago, I had a student that was just a first year, and it was like a horrible Monday. So I'm hoping that I didn't scare him away. I haven't heard from him. He only had to do like 3 4-hour sessions. So we'll see. But then he got to see exactly all the stress and the critical patients that we encounter.
That's great. I'm sure you didn't scare him away. You probably got to show him all that you were able to do as a family physician. How about other experiences with medical students or tips to be able to use medical students in your office to help your work?
I don't know. Can you hear me? Hello?
Yes, Dr. Zona, we can hear you.
Good. Great. Chris Zona up here at St. Luke's Family Medicine.
Yes. Yep.
In Perrysburg, Ohio. And, that's why I went into this as a career. I just love teaching students and learning from students. And I agree with Dr. Morris, getting them involved with the lab, with the microscope. I have a dermoscope that I use, introduce them to the world of dermoscopy. And the other thing they really love is, especially if they're there for a month and they get to see the patient again, they see that continuity. That's a big impact on them because they feel very empowered knowing the patient already. They're not going in there green. They remember them, the patient remembers them, and that makes a very big impact on a student. Also, I think being able to know the family. I can tell them, gee, I've taken care of the kids, the grandkids, grandma, I already know the family history. That really makes an impact on a student, that you remember a family history. You don't have to go through every single detail because you know them. And I find that a lot of times the students keep me extremely sharp with the questions that they ask. It never hurts to go back to basics of history and physical exam. And then working with them on a differential diagnosis. So I definitely agree with what's been said. It's a great thing, and I just love to do it.
Well, great. Those are really great points that you made. Anyone else want to share just their experiences with precepting or ways that they've been able to have students help them in the office?
If anyone would rather just send their message to the chat, I'd be happy to share it as well. So I'll just put that option out there too.
So I'll go through just some of the things that the AFP, or I'm sorry, STFM has listed in terms of how students can add value to our offices. And then maybe we can react to some of that. And I think even just reflecting on when we look at, precepting bringing us, we could talk about that a little bit. Before a patient visit, students can help with pre-visit planning. So putting in, identifying preventive care services where appropriate, or looking at what medications need refilled, determining what labs are needed, calling patients in advance of visits to discuss anything that needs to be prepped before the actual visit. They can meet patients in the hospital if you do inpatient care prior to discharge, and then see patients during the outpatient visits after discharge to have that continuity that Dr. Zona was talking about earlier. Conducting concurrent visits with the preceptor, so the preceptor can complete one or more of the visits while the student conducts basic components of another visit. Another way is to participate in goal setting in advance of the patient visit. So what will the student ask and how, or what is the anticipated outcome for the visit if the schedule is reviewed ahead of time. And then lastly, reviewing social histories and participating in huddles in order to understand the patients. So the student will not only be more effective in the office, but also become a better doctor. So those are some things that they list that the students can do before the visit. And then during the visit, the students can help room patients. So it empowers some of our nursing staff to help educate students, and it allows students to really learn team-based care. And it allows the students to help patients and families complete some of the different paperwork we want them to. So the mini-mental status exam was brought up, or developmental screening, or different questionnaires or school physical forms. Students can help document care in the electronic health record, so updating problem lists and medication lists, writing or pending orders and prescriptions if you're able to do that, helping with after visit summaries and reviewing them with patients, and then actually helping with the encounter note, especially with some of the Medicare changes that have happened in terms of allowing students to document more. One thing I will do sometimes if I want to observe the student but still be efficient in clinic is I actually will scribe for the student, so that lets them ask questions, but it helps get some of that documentation done at the same time. So that's another way to look at it, of how things can go during an actual visit. Students can help with performing medication reconciliation. So if your nurse needs to go do some other things for you for a patient, they can, help with that. If your nursing staff is doing that in advance of you seeing the patient, they can talk about side effects of medications, assess for any interactions, identify what immunizations need to be given or blood tests, finding and review like patient education materials with patients, looking at care plans with patients, and then just giving common patient education talks on, kind of bread and butter family medicine topics. And then after the visit, students can, with supervision, answer questions. If there's, kind of an in-basket function that students could help with. If you have that in Epic or other things, they could, help respond to those, or they could help interpret lab results and what needs to be done. And it would be great learning for them. They can help call patients, which gives them an opportunity for that continuity again, if it was a patient that they saw in your office with you. They can accompany patients to specialty care visits, the hospital, or even their homes to do a home visit, and make calls to help coordinate care, like social work assessments or referrals to other resources. Students can work with team members to help manage the care of populations by, helping look at your panel of patients during the rotation and looking up some data, working with the front desk staff, lab techs, nurses, social workers, care managers. Like they don't have to be with you all day long, because that's really allowing them to see how all of your patients are being taken care of. Setting time aside to perform pre-visit and after-visit care. So students understand that that's an important part of taking care of patients and things that we do, because that's how we can take care of patients the best way. And helping teams meet quality metrics by working with patients and understanding like how to best document that in the EHR. And if you don't have access to a lot of different resources, students can contribute to the team by enhancing those skills by creating handouts or bookmarking patient education sites that could be helpful. Some students have amazing computer knowledge and can actually probably give some tips. I've learned some tips on some of the EMRs I've worked with students, because they have figured things out faster than I have. Answering clinical questions that arise during patient care and sharing the answers with the preceptor. And then even just what medical apps are out there. If it's one that a preceptor hasn't seen before, that can enhance clinical skills as well. And I'll send out we'll have some resource links where this webinar is going to be hosted, and I'll include that. But I'll just pause there to some of those different ways that you can incorporate students into helping your care of patients. Do people do any of those, or did you hear one that could be helpful that you're not using now?
Yeah, Chris Ona again. One of the other things that I do with students is using evidence-based medicine at the point of care, and have them use a lot of apps. I have them use the ASCVD app and figure out the patient's 10-year risk. So a lot of the apps that we use, I get them involved with. Plus, as you said, I learn apps from them that they use that I didn't even know about. So I use them for evidence-based medicine at the point of care.
That's great. How about others?
I found it interesting that you said getting them involved in the pre-visit, like kind of pre-chart planning. I'd always been one that just has them come right before patients start, and I've never really kind of involved them in like my pre-morning, pre-game ritual for the task at hand kind of stuff. But so it was kind of interesting thought getting them involved there to really dive in and see if they're due for any of the preventative care and stuff.
Great. Yeah, it might be able to save you some time. They could do some of your prep work for you. How about other people?
I do have a comment that was submitted by Dr. Bellin. We have students identify area of need and develop their own quality improvement project. It's a win-win situation since students feel they are already making a difference and at the same time improving our patient care.
Oh, that's a great idea. And definitely a win-win situation. So that's perfect. How about others? Are there different ways that you've used students in your office, or did something resonate with you, or was it a new idea from that list?
Yeah, Dr. Zona, I agree with Dr. Morris. I don't think I've ever utilized students beforehand, even though they do review the charts. I don't think I've ever formalized it where they utilize it. And I certainly have never sent them out to the front desk. So interesting expansion.
Oh, good. Yeah, I think just as we move more and more towards team-based care and value-based care, I'm hoping to have people help us with that. I think if they can be exposed to different team members, I mean, when you understand that everybody plays an important role in caring for patients and being able to see what that is. Oh, sorry, my lights went out. You know, and then, you know, just I think it opens their eyes and they're actually able to see that through all of the rest of their rotations and that kind of thing. So how about anybody else? Any other thoughts, ideas? So when you think about how precepting, I think a lot of you have expressed how it brings you joy. Do people feel like precepting brings you wellness? Or how could it bring you wellness?
But medical students are very intelligent people. So definitely I've learned a lot from them over the years on you know, things from sitting down versus standing up, utilizing new vocabulary. It's no longer a waiting room, it's a reception area. It's no longer an exam room, it's a treatment room. So I learned all of these new vocabulary from students, which are right on the cutting edge of service orientation. So I think that's a wellness factor. Plus, just the interaction with the next generation for old people like me is great to see how people are carrying forward ideas that we started and expanding them. It's that's wellness.
That's great. What about other people?
Well, it's paying it forward by helping somebody else. We help ourselves.
That's a great point. What about people that aren't preceptors currently and they think a little bit more about the challenges and the time piece of things when they think about being a preceptor for medical students? How do you think, how could there be an approach to explain how being a preceptor can actually bring joy and wellness into their practice?
I think it's always one of those where it's best like led by example, where they can hear us having fun, joking as my partners are in the other offices around me, and they still notice that I still get out and before they get out, because all my notes and stuff are done prior. And so I think it's showing the difference in just the mentality, and then having the open conversations with them, talking about like, hey, I had this really cool student. They showed me this new way of doing this. Have you heard about this new study or something along those lines? Oh, my student told me about it actually. So it's like leading through the example and letting them kind of know the experience rather than just coming at them and being like, hey, you should pick up a student. Like just kind of giving them the background knowledge so that way they can make their own decision, but they see that it's kind of in the better step for them.
That's a great way to explain it. How about other people, medical students? Any other thoughts?
So can anybody join the Society of Teachers of Family Medicine?
Yes, anybody who's a teacher of family medicine, so they don't even have to be a family physician. If they are a teacher of family medicine, they can join STFM. Other questions, thoughts just about thinking of our wellness and being a preceptor and how those two things can help each other? All right, so I did want to go over, so I think sometimes one thing that people feel is a barrier is just how to be a good preceptor. And so there are some resources, like if you have partners who are thinking, I mean, because a lot of you who have talked so far are clearly preceptors and absolutely love it, and that's amazing. Some of the people on the call who haven't spoken up as much, if you are a preceptor, that's great, or if you're thinking about it, that's even better. But if anybody is kind of looking at, gosh, like how do I be a good preceptor, because I think we all want to be high quality preceptors, and then we want high quality preceptors for our medical students for family medicine. So STFM has this site called teachingphysician.org. A lot of medical schools buy memberships to it for their preceptors, and there's all sorts of different topics and content, but there's also some teaching development pieces as well. So if you are a preceptor, you can ask your institution if they have a membership to this, and then you get access to a whole bunch of things. But if you don't have access, like a login, these 3 topics are like not behind the firewall, so anyone could access these. So, why precept, the teaching roles of a preceptor, and then finding a clerkship. And then this, the ABFM website, and again, I'll include some of these links on what we'll post after the webinar. So that is some information about the STFM and ABFM pilot that we talked about earlier in terms of getting SM is working on some training modules for students. So part of it is we're talking about all these different ways that students can help us with our practices, but if they're not necessarily prepared to do that, then it's not a win-win. So they are looking at like how can medical schools prepare students to, one, get a huge benefit out of helping with patient care in our offices in this way, but then also help us at the same time. For those of you that are in Ohio, there's great precepting, which I'm going to kind of kick it off to Caitlin for to talk a little bit about that. And if anyone's on the call who's not from Ohio, a lot of chapters have these opportunities as well. And so definitely check with your state chapter to see if this is an opportunity. But Caitlin, do you want to talk a little bit about the summer preceptorship program?
Yeah, absolutely. And I think actually there are a few of you that have participated. The OFP Foundation's flagship program is a summer opportunity to pair first-year medical students, so they have completed 1 year of medical school, with practicing family physicians for a 4-week rotation. And it could be anywhere in the state. I work with the medical schools to help coordinate placements. Right now, we offer stipend funding to the students, and we have capacity for up to 10 students per medical school. So up to 70 students to have that experience in the summer months. We also partner with the Ohio Association of Community Health Centers to try to get students in their FQHC sites. So they are a huge partner in the program to really kind of get a feel for all the different practice settings out there. We're currently in the thick of recruiting, so if this is something you want to jump in, check out our website. I'll include it in our follow-up email today about the program, but it's pretty flexible as far as hours and what months over the summer, because we know your summers are very busy. So really working with the student and the physician on kind of coordinating 4 weeks total. But I can provide any information if you're really interested. We'd love to have you. I'll collect some information from you and then just kind of see if we have students in your area looking for a site. It's kind of based on where the students' needs are. But I'd love to have kind of a database of preceptors that we can call on if you're interested in that in those summer months. But that is kind of it in a nutshell. Again, I'll send you some links and information in the follow-up email, and we can chat more if you're interested.
Does anybody have any questions about that at all, or if people have done it before, any comments about being a summer preceptor? It's definitely a great opportunity, and if people haven't precepted before, a nice way to kind of try it out for a little while, and before committing to, oh, I'll take a student every month, for their clerkship, those kinds of things too. So
absolutely,
yeah. So just to go over some of our take-home points for today. So one, I think we had the opportunity to talk about benefits in terms of being a preceptor that brings us joy and wellness. A lot of people kind of shared some of the pay it forward stories, or just being able to get joy from seeing the students learn. We also talked about some of the tangible benefits of being a preceptor. So the AFP CME credit. Next month, the STFM and ABFM pilot that will give performance improvement credit for being a preceptor, potential tax incentives depending on what state you're from, and the opportunity just for recognition for being a preceptor as well. And then we talked a little bit about some resources that are available to help us be high quality preceptors. And we reviewed some of the opportunities to precept, especially during the summer. Any last comments or questions before we wrap up our webinar? No? Okay. Just making sure, we met your goals and we met kind of what you're hoping to get out of it by joining today, and definitely appreciate that.